So I'm about to go in depth into talking about a lot of issues surrounding the anatomy of the vagina. Okay, that's like issues surrounding vagina. Okay, so before we talk about the issues, it's good that we now have an overview of the anatomy of the vagina. Okay, so for the anatomy of the vagina, this is it, everything about it. Okay, so from the external genitalia, that's like the outside. The outside is called vulva. Okay, the outside is called vulva. So vulva encompasses everything you can see visibly from the outside. Okay, so you can see the mons pubis, you can see the labia majora, you can see the labia minora, that's the inner lips. You can see the clitoris. So it has over 8,000 nerve endings. Okay, you can see urethral openings, that's basically for urine. Okay, the opening of the urethra. You can see the vagina opening itself, which is known as what? The introitus. Okay, so you can see the clitoris, you can see vagina opening, that's the introitus. Alright, so talking about the internal structures now. From the outside you move to the inside, right? So length is usually about 7 to 10 centimeters. Okay, but it's highly elastic. Okay, so walls, we have the anterior and the posterior walls. Okay, fornices, that are domed areas around the cervix, have the anterior and the posterior one for semen pooling. So histological layers, we have stratified squamous epithelium. Okay, have lamina propria, we have fibromuscular layers. Okay, then we have adventitia. So blood supply, we have arterial supply is uterine and vaginal arteries. Okay, venous drainage is the vaginal venous plexus. Okay, though I didn't actually bring the pictures, but you can use your atlas to see it. Lymphatic drainage, inferior vagina is to the superior inguinal nodes. Middle and upper vagina is to the internal and external iliac nodes. Okay, innervation is from the uterovaginal plexus. Okay, somatic innervations from pudendal nerve. So functional roles is a passageway for menstruation, for sexual intercourse too, for childbirth it's a passageway for the baby too. Okay, self-cleaning, so it maintains a pH and normal bacteria are usually there. Okay, and through natural secretions. Okay, but you can still clean it with some feminine wash and all of that. Okay, so that's it for the overview of the anatomy of the vagina.